I'm given a second chance in life.
I'm thankful for the genuine care that I receive here.
NKF helped me for my dialysis and give me a peace of mind.
The National Kidney Foundation was set up by Dr. Srinivasan together with Rotary. So Rotary wanted to help the kidney disease patients. Once a patient is on dialysis treatment, he's on treatment for life. The first dialysis homemade system was actually developed at Asunta Hospital by Dr. S.S. Gill.
My interest in nephrology started in 1958. I just became a medical officer of the housemanship in General Hospital. And I had a physician who was treating kidney failure patients. In those days, there were no machines. Before that was the twin call machine, where anybody with kidney failure was treated. If within 1 month or 6 weeks the kidney didn't recover, they were given up. They couldn't continue.
Well, the NKF mission basically was to help patients with kidney disease. And to do this, we want to go through health promotion, disease prevention, early detection, as well as to help people who have established kidney disease. For those that got kidney disease, we help them with dialysis. And for those who do not have enough money, then we help them to pay for it. We need to continue to work with Rotary. Rotary has been very good and wonderful in working with our support. And we need to learn to continue to work with them successfully. At that time, there were a lot of patients who developed kidney failure. They were going to die unless they received dialysis treatment or they received a kidney transplant. NKF was the first to start the organ donation program. So I worked very hard with Srini on this particular initiative. Malaysia is probably the one developing country where anyone who requires dialysis can receive it.
The National Kidney Foundation, or NKF, is a non-profit organisation that champions the cause of treating, educating the public and empowering kidney disease patients. NKF believes that public awareness and early diagnosis can prevent kidney disease itself, and that health screenings and public education should take place throughout the country. NKF has programs that range from health conferences to patient forums and subsidised mobile health screenings that have screened more than 482,000 Malaysians since 2008. 99% of people on a waiting list for organ transplants are waiting for kidneys. What's really alarming is less than 1% of Malaysians have signed up as organ donors. But there are 25,000 patients still waiting for kidney transplants here in Malaysia. Dialysis centres are the heart of NKF. They operate with the highest of standards, certified by MQA, MSQH, and recently receiving the Brand Laureate Award. Patients who come here often. This gives them time to build relationships with the staff who are determined to enrich the lives of everyone in their care. The National Kidney Foundation is determined to make sure that subsidised treatment is available to everyone, because 57% of patients have a disposable income of less than 1,300 ringgit per month, and 87% of them are unemployed. NKF subsidises 50% of all dialysis treatments for all of their 1,600 patients, giving a grand total of 24,960,000 ringgit to subsidise those patients alone. And that's without operational costs. The National Kidney Foundation needs 30 million ringgit a year just to operate, and that's why the NKF needs as much help as it can get.
I started my dialysis 10 years ago. My kidney has already deteriorated. The doctors told me to be prepared for dialysis. That's how I started to come here.
I'm Wong and very unlucky to have this sickness. I had diabetes at the age of 14.
Just a month after my father passed away, my mom was very sick. So the doctor have checked everything and he said that 2 kidneys had been failure.
Oh, I am very sick
I cannot pay money because I cannot survive. And then I asked them lah, better you change me some other place lah. I cannot afford this much money. I come here lah.
Without this dialysis center, we really very difficult to survive.
Dialysis is very expensive. I can't afford to pay every time for weeks. I apply for some kebajikan and everything. Then they help me getting some NGOs to help my mother to do dialysis.
I need to thank all the doctors at the hospital. They help me a lot in the way that I get accepted what I am now.
One thing I like because my nurses are here very good. They all take care of me like my daughter.
I really like this place. I like the administration, managed by sister. They're very clean.
The nurses are like very friendly to us. They're giving a good advice on medicines. Also, they're helping us. They're doing it softly. They're very patiently. They're doing their job. Like not only a friend, more than a friend. It's like own sisters. I hope that NKF will be opening more branches lah.
Saya memang suka jadi nurse. So saya tak ada rasa beban datang kerja as a nurse. Saya harap National Kidney Foundation semakin maju, memberi rawatan yang paling bagus, berkualiti kepada pesakit walaupun kita NGO, tapi rawatan yang kita bagi dan kebesanannya tu dapat pada pesakit melebihi daripada rawatan di luar.
The National Kidney Foundation was founded on a passion for people and the vision to reach people across the country. I'm proud to say that everyone in NKF now shares that fire that started this foundation. We will continue to dream big. We've come a long way in 50 years and will continue to strive to reach everyone as a beacon of hope. The National Kidney Foundation has impacted the lives all over Malaysia, particularly for those with kidney disease over the last 50 years. We'll continue to serve the community and empower those affected by kidney failure to improve their quality of life.
The National Kidney Foundation has left a legacy and will continue to ensure the health and well-being of its patients. Your trust and continued support inspire us to carry on doing what we do best, providing dialysis care to poor patients and educating the public to take care of their kidneys.